We've all heard of PMS, but have you heard of PMDD? Let's see a show of hands if you've heard of that. No, never heard of that? Okay, well, you're not alone. It stands for premenstrual dysphoric disorder. And here to tell us more about it and the link between periods and mental health is Dr. Marjorie Dixon. All right, Marjorie, tell us more about PMDD. Interested to learn about this.
Okay, so PMDD is premenstrual dysphoric disorder, but in order to get a good idea of what that is, I think you need to know a little bit more about PMS. So it's an extreme form, PMDD, of PMS, which is premenstrual syndrome.
Right.
So it manifests its kind of physical symptoms and emotional symptoms, and it always happens relative to your period, right before your period, and it ends within 4 days of getting your menstrual period.
Right.
Okay? And so that is, you feel physically bloated, breast tenderness, you know, leading up to your period, bloated, breast tenderness, moody. You get pimples sometimes, a little bit of acne.
Yep.
Sometimes people complain of back pain, knee pain. People say, I'm like a weather vane for my period. I feel it in my joints.
Yes.
Like that's part of the PMS symptoms. And then emotionally, you feel like irritable.
Okay.
Like you look at people a little bit differently in that period. So, and then some people feel low mood. They feel kind of depressed.
Yes.
Some people
That's
feel,
where I go. I go sad.
yeah. Some
Yeah.
people get so some people get mad, and some people get
Yeah.
like, you know, anxious. Like, oh my God, I never feel anxious. All of a sudden, I'm all right. I'm getting my period. So, so those symptoms leading up to your period, and it's called premenstrual. So 90% of women will have a symptom of premenstrual symptom at some point in their lives.
For sure. One or two.
Right.
Yeah.
If you think of premenstrual dysphoric disorder, that is much more rare, and it's a much more extreme form of PMS, but it disturbs your ability to function. So you can't go to work. You can't get through things that you usually do get through. It's a pervasive problem for some women, and it happens in less than 5% of all women having periods.
Okay, so it's extreme on the emotion side or extreme on the physical side, or some kind of combination of both.
And it interferes with your ability to function. So when you get your period, you get cramps, you can go to work.
Yeah.
For some people leading up to their period, they're so bloated and feel so uncomfortable and feel so irritable that they're like, I'm just going to stay home.
Got it. Because
Okay.
it's that bad.
Because it's that bad. And it's a syndrome. It's actually, you have to diagnose it by diarizing it. So in order for it to be a real diagnosis, it has to happen 3 months consecutively. And then it also is something that are consistent symptoms that happen 3 months consecutively, linked to the second half of your cycle, right before your period and ending with your period.
Oh, it's very specific.
It is very specific.
Okay, so do we know what causes it? PMDD?
Yeah, so the issue is no. Every woman that has a period is at risk of it, technically.
Yeah.
Those who are at greater risk of having the more severe form are those women who have a history of depression. So if you have depression in your family, or if you personally have had depression or are experiencing depression. The other thing is if you have had a history of postpartum depression.
Yes.
And why? Because it's related to your hormones.
Got it.
Right. So what happens, and we've talked about this about your menstrual cycle, what happens in the first half of your menstrual cycle is estrogen goes up, then you ovulate, then it pummels.
Yeah.
Progesterone goes up. Progesterone's the hormone that makes people angry, not happy. That's the hormone that's there. And it's that hormone that you have the physical manifestations of all of these things. When some women are susceptible to that hormonal change in their right before their periods, imagine after a pregnancy. Where you've had a placenta that's full of hormones, and then you deliver and it goes away, and that's the risk of postpartum depression. So people who have those predisposing risks are at greater risk of having the more severe PMDD.
It's interesting because there isn't a lot of, I would say, societal acceptance of PMS, and definitely not PMDD, which we're all learning about today. But if you're like hangry, or if you haven't gotten enough sleep, we do understand why people are off, why their mood is off. Why don't we have that acceptance for PMS and PMDD?
I don't know. I think, you know, if you look back historically, nobody ever looks at periods as like, I got my period. It's a fantastic, right? Like, people are like, oh, I got my period. Yeah, and historically, like even the things connotations that we have on the rag from the 1800s, when women used to like tack rags in their underwear and their undergarments while they got their periods, or you don't say Aunt Flo came to visit me, or like Aunt Flo came to visit me, right? Right? And, or you know, it's just, there are no great connotations. We need to take it back. Like, if we looked at it differently, if we rewrote the history, I think, you know, it's an empowering time, but it's associated with so many symptoms. And the issue is we've been so calm and carry on that if you have really bad cramps, you're just like, I'm just going to manage it and get through it. As opposed to, I have really bad cramps and I feel really awful. Is there something I can do about this? Because periods for a lot of women just come and go.
Yeah.
Right?
Yeah.
And so that's kind of what the mainstay should be. We should revolt against all the negative connotations that come with it and say, you know what, it's fixable. There are a lot of women healthcare specialists who can talk about this and who can fix things for you.
And how can PMS and PMDD be treated?
So, you know, the main thing you can do are lifestyle things. We talk about it on Cityline all the time.
Yeah.
So regular exercise throughout your month.
Yeah.
And when you are reaching this time of your cycle, if you're bloated and you have, you know, symptoms of breast, all that stuff, then don't eat the bad foods that exacerbate it.
But you really want it.
I know you really want it.
Yeah.
But you gotta try to avoid
broccoli.
Well, not necessarily, but
spinach.
You can have, like, can you deep fry
spinach?
Like, when you want that, when you have that hankering, limit it.
Right.
And then continue in your good habits. Just a little, have a little bit on hand.
Yeah.
But then try not to do it because it exacerbates your symptoms. And then there are medications. If those lifestyle things and exercise and eating well doesn't work, then you have like NSAIDs, medications that help with the pain that are specific for that. We can put you on the pill so we don't have the ebb and flow of hormones. We mainstay our hormones, but the pill can have other effects.
Totally, yeah.
And sometimes even selective serotonin uptake inhibitors. Those are the things you use for anxiety and depression. Keeps the happy neurotransmitters in your brain higher.
Yeah.
That's what you use for treating anxiety related to PMDD.
Okay, very interesting. So now, class, we've learned about PMDD. Now we know what it is. Is there anyone in the audience who can actually identify with this or believes they might be experiencing it? Does it look like you at all? Does it sound like you at all? No, zilch. Well, it's 5% of the population. So
and it ends with menopause.
And it ends with menopause. Another check mark for menopause. Yes. Okay, I love this. Make sure you get checked out if you were having severe symptoms. That's the most important part. You shouldn't be. You should get it checked out. There are things that can be done.
Yes.
Okay, thank you for that.